implementing suicide prevention strategies. Also, Illinois right now, the bill that created that alliance back in 2004 required it to follow the 2002 Surgeon General's report on a plan for the country for suicide prevention. Surgeon General issued another one in 2012, but by statute, the alliance must follow the old law. And also, just so many things have happened in suicide prevention through research and experience that we now know different ways that can be used to prevent suicides. And the state of Illinois needs to update its suicide prevention plan to include those new plans and strategies. So what this bill would do is to have the alliance, which exists now, try to develop a better plan that's based on current law or current strategies, current research, to then present that to this Office of Suicide Prevention that would be responsible for implementing it. It would coordinate activities of state agencies, county, local governments, and even nonprofit organizations. Just figure out how to get them all together and get suicide prevention activities into this state. So now I'd like to have Senator Steans come up and talk a little about the work that she's doing for this. Thank you.
Well, and really, Steve said it all. I mean, I'm involved here. You know, each one of those nearly 1,500 lives that we lost to suicide has much greater impact by loved ones, people that are left behind, wondering and questioning what could or should we have done differently. And there are strategies around this that we know about, we can learn from. And the state of Illinois really has not been updating this since 2004. We've been behind on this. So we are viewing this as an opportunity to really try to implement best practices around try to prevent suicide. It's been a growing issue, I know, on college campuses as well as just in the general public. We need to have a lot more of a concerted effort on what we need to be doing and what kind of resources we should be providing to prevent this preventable reason for death. It's, you know, now for kids in the age 15 to 34, it is the age group 15 to 34, it's the it's the third leading cause of death for that age group. Fourth leading cause of death for ages 35 to 54. I don't know that people understand just how much of a growing problem this is. So really appreciate the work that Steve's been doing with his chapter here. He's been doing this in large part on his own outside of state government because we haven't had somebody here who is focused on trying to put changes in place and bring around the public health perspective that we should be. So we're charging, what we'd like to do is make sure we have somebody who day in, day out, this is what they're worrying about, is just how do we improve and reduce the amount of suicides here in the state of Illinois, which clearly has been going the wrong direction. So welcome any questions you want, and really just want to thank Steve for the leadership he's been providing on this issue.
Senator, what draws you to this issue?
Well, excuse me?
What draws you to this issue? Do you have a story about this?
You know, I don't have a personal family member who has committed suicide. I have close friends who have. I have another close friend right now who's a suicide watch for a daughter. It's just prevalent. And every time, one of the things that really raised it for me is I have lots of college interns every summer. And when we talk, when I get them all together as a group, one of the first things that they raise that needs to happen on college campuses is suicide prevention. That they all know somebody on their campuses that has committed suicide. And this is whatever college they're from. It just has been felt by me that it just is a growing issue for particularly that young population.
Why has the rate gone up?
It's been going up nationally. In Illinois, we think it's going up partly because we haven't done a good job of working on it. But there are various theories, but I honestly can't say. And that's really if you talk to anyone that's lost someone by suicide, and by the way, I should have said, I lost my son to suicide in Paul Schumann Moore in 2006. And every day of my life, I ask that question, why? And I think if you talk to anyone that's lost someone to suicide, that's the same question they'll have. Even if this is someone that had spent years struggling and going through therapy or medications, they still ask why. So when you ask why is it going up, I honestly don't know, but I think that partly is we're not putting enough resources into it. Suicide is preventable because 98% of people who died by suicide had either a substance use disorder or some sort of a mental health condition. So if we can treat substance use disorders and treat mental health conditions, we can reduce suicides. And that's why a lot of the advocacy that AFSP does is really related just to getting out mental health services and trying to make that more accessible for the entire population. Because if we can make people mentally healthier, we can prevent suicides.
Senator Steans mentioned that this is an effort to implement best practices on trying to prevent suicide. Can you elaborate on what some of those practices might be?
Sure. Give you an example. Within, I have to look at the numbers, within several months of having visited their primary care physician, almost half the people who died by suicide had visited their primary care physician within a couple of months. And a very high percentage had been to an emergency room within the past year. If we can get primary care doctors and emergency rooms to do screening for those that may be at risk for suicide, we can perhaps get those people, whatever behavioral health care they need or any other services. They can also, for example, there's various intervention practices when you see someone at risk that can minimize future risk, giving them a safety plan, someone to call when they're feeling depressed, things like that. So there are techniques out there, for example, just in the behavioral health or in the medical care systems. I mean, that's something that a lot of states are doing. There's a whole movement called zero suicide, that hospital systems actually really go from every single person in the system understands screening, and then once they've screened someone at risk, they then do a more firm evaluation, and then they put some sort of intervention into that, and follow up. After someone leaves the hospital, see if they made their appointment to their psychiatrist or psychologist. That's just one example. Getting information to schools. For example, bullying is a problem in grade schools. Anti-bullying campaigns are always very effective for suicide prevention. There are different groups. For example, law enforcement. Law enforcement has an entire culture of not caring for themselves, of being afraid to address issues of mental health conditions. And it's also obviously a very stressful job, both because of the things that they see and just odd working hours. These are all things that combine to make law enforcement or firefighters a very high-risk group. And there's things you can do to work on those cultures. Get those fire departments, get those police departments to make it that it's something that is acceptable to come and talk to the peer support or employee assistance program. So a lot of it is just getting out, identifying those at-risk groups and figuring out how can we, what is different about this one and how do we go after them. So there are techniques out there that have been tried, best practices that are working.
You mentioned that the Alliance follows the 2002 Surgeon General's law, and there's a 2012 law. What has changed? What are those new plans and strategies? Is there anything significant that we can't do because it's a prior law?
The healthcare thing that I mentioned is, probably the biggest one. A lot of the effort that goes into suicide prevention that the Surgeon General recommended really got into getting healthcare systems to implement either the zero suicide, as kind of known nationally, or just some sort of a system where the entire healthcare system, particularly primary care, recognizes that it really is the first line of defense against suicide is your primary care doctor. A lot of people, they get their behavioral health medication from their primary care physician. That is the one that ought to be doing the screening and assessment and appropriate referrals.
On that line,
sure.
The largest population of suicides that have been growing in the state of Illinois are underserved and minority populations, folks that may not have a primary care physician. How is this new office going to help the underserved, the low income, the minorities, the GLBT community? How is this office going to help them with their suicide risk factors and prevention?
Well, that's exactly what this office would be doing. It would be identifying groups that are higher risk and determining what are the best practices being used around the country to achieve some sort of suicide reduction for those particular populations. The other thing that I should mention, just within the last 2 years, Illinois has joined the National Violent Death Reporting System. And so Lurie Children's Hospital is now in charge of handling the Illinois Violent Death Reporting System, and they're acquiring data that gets into a lot of the details that Once we see that data, we can make determinations of what special groups hadn't we even thought about that are at risk, or what types of conditions, what types of activities are causing suicides, and those will give us ideas. This would give this Office of Suicide Prevention ideas of what they can be doing. So it's a combination of getting some new data that lets us see those problems, and then figuring out what others are doing around the country that can address those problems.
Senator Steans, what more can the state of Illinois do in terms of, as the legislator, what can you bring to the table to aid in the prevention?
Well, certainly we can assure that there is a place that's actually charged with this work and developing statewide strategies for it. As Steve mentioned, our last effort around this, well, in 2004, last time we did anything legislatively, put something in place, was using data based at that point in time, and we don't even have a person full-time who's responsible for the issue of suicide prevention. So we can bring attention, focus, and some resources, and really it's working a lot through other channels. But that's what it needs to be, is what's the actual best plan, using best practices, and making sure that we're actually monitoring it. We can be reporting on it, letting people know what they could and should be doing, and having a lot more attention be brought to the issue. It's been clearly a growing problem through many different populations, as you mentioned. It's the LGBT youth are much more likely to commit suicide than other populations. Minorities are very much in that pattern. Particular age groups are much in that pattern. We've been seeing it now in the police significantly, and we need to be tailoring our strategies to each of those groups. And right now, we don't have the resources, the focus on that problem right now. So we need to help with that.
Well, we're supposed to look for warning signs, and what's the difference between being depressed / suicidal, if I could conflate those two for this purpose, and just kind of having a bad day, being down?
There are various things. Number one sign is someone talking about suicide. And really the primary advice always given is, if you think someone may be at risk for suicide, ask them. Ask them, are you thinking of suicide? Have you made a plan? Have you acquired the things you need to do that? Finding out, and then that can get them to open up a bit and determine what they need to overcome that problem. But there are various things that one would look for that I agree, may look like depression. Things like, sleeping too much or too little. Change of, a lot of it just comes to changes. If someone is all of a sudden exhibiting changes in behavior, whether it's sleep habits, anger management, you name it. Those are the kind of things that one looks for. But more than anything else, it's again, if you think it's a problem, ask. I'm wearing a button here that says, be the voice, and the idea is, to be that voice to that one person. Ask that person that question, and then do what you can.
Is there any financial assistance that could be of help? I know that there's different grants for colleges across the U.S. I know that there's the Zero Suicide Grant Program, I believe, that's operated by the federal government. I mean, what do we have? What resources do we have financially, and should that be increased?
Well, that's one of the things that this office would be able to do, is to either itself or assist other agencies, or whether it's state or local, or even nonprofit organizations, to seek some of those funds and get them into Illinois. There are, we do get some of those grants from SAMHSA. Some of the colleges in Illinois have gotten some SAMHSA grants to do suicide prevention activities, but really that is really one of the goals that we have of this, is to have an office that's responsible for getting some of those funds into the state.
All right, thank you. Oh, one more question? We'll make your last question.
Yeah, just one last question. This might sound a little bit out of left field, but can you comment, do you have any opinion about what role physical health may play in mental health? In other words, if, you kind of made an oblique reference to people not getting enough sleep, for example. Now, cause and effect might be difficult to determine in those circumstances, but is it possible that there's some physical health issues that may be impacting people's mental health ultimately? Do you have any opinion on that?
What I first want to say is that, when I mentioned that 90% of people that have died by suicide had some sort of behavioral or substance use disorder problem. Another group is those that have chronic pain, and chronic illness, and
Digestive issues,
kind of
for
lost,
example,
and
are very correlated with these types of issues.
And so, really, this word hope, someone that thinks that I'm going to have to live with this pain for the rest of my life, there is no hope. I mean, that is a definite at-risk category, and if whatever we can do to deal with that physical health condition can reduce the suicide.
Okay.
I don't see any funds appropriated in the bill to the office. How much are you thinking it might cost?
Well, we're going to sit down and talk with the Department of Public Health and try to come up with a plan on what we'd like to do in the appropriation, and then hopefully that will be part of the budget negotiations then, that we can make sure we are properly resourcing a new office on this.
Can I ask one last question?
Okay.
Are there gonna be any, in which is my sister is on, I'm doing Facebook Live, and she's on here asking, are there gonna be any preventive programs? We talked about colleges and universities and stuff. What about in the elementary or junior high schools? And would there be funding set aside for them to put in programs, preventive programs in those type of schools?
Well, as the Senator said, right now there's no funding in this particular bill, but really one of the functions of this office is to make recommendations to the General Assembly of, I think we need to have funding for this kind of program.
And I do want to add one thing on that. We do, Illinois is a state that's got social and emotional learning standards in place. A lot of states don't have that. We have that. We can do more with providing training and education for everybody in those school buildings on how to best implement those social and emotional learning standards. Because when you do that, you can do a lot to help prevent bullying that could be taking place and leading to that. So there's a lot of work we can do within the current construct of our school buildings, and certainly social working and how much we are supporting social works and nurses in those buildings also can help. This bill doesn't particularly do that, but we are as a state putting and investing more dollars into the school evidence-based funding formula to get more resources into the hands of the schools. Okay. Thanks. Thank you, everyone.
Thank you, everybody.
Thank you.
Thanks, folks.